welcome, and let me present my progress on the 3-month progress report about the comprehensive therapies of acne, from conventional therapies to microbiome modulation. So my name is Hanna Potra. I'm a medical doctor and a full-time PhD student at the Department of Dermatology at the Semmelweis University. Here you can see my lovely supervisors and my SMS that are helping me to widen my vision on improved care of acne patients, and we would like to achieve this by implementation of novel therapies of acne. So far, I have 2 specific goals. The first one would be about the microbiome modulating agents affecting the acne treatment, and the second one would be about the isotretinoin treatment. Let me present my first topic about investigating the efficacy and safety of microbiome modulation in the treatment of acne. First of all, you might know that acne is a chronic disorder affecting hair follicles and sebaceous glands. It affects 9.4% of the global population, being the 8th most prevalent disease worldwide. Unfortunately, it decreases the quality of life. This means that 27.2% of these people develop depression. It's quite a huge number. It has multifactorial pathogenesis and risk factors, the role of dysbiosis because of the Cutibacterium acnes. Among its standard treatment, we can mention topical treatments and systematic treatments. In the topical treatments, there are retinoids or antimicrobials. Meanwhile, in the systematic treatment, there are antibiotics, hormonal therapies, or even the isotretinoin. So, retinoids are in the center of this acne treatment, but they have several side effects, such as photosensitivity or teratogenicity. For this reason, I would like to assess the novel treatment options, such as the microbiome modulating agents, probiotics, prebiotics, postbiotics, and symbiotics that have much better safety profile. The disease activity scores would be measured in lesion count, global acne assessment score, mean irritation score, and LEAD score. So my aim is to evaluate the efficacy and safety of microbiome modulating agents in the treatment of acne. As my clinical question, I would like to ask, which is the safest and most effective microbiome modulating agent in the treatment of acne disease? For this question, I built a PICO framework that you can see on the screen. I'm working with acne patients using novel microbiome modulating agents, standard acne treatment, and last but not least, placebo. As the outcome, I will measure the efficacy, the safety, and the quality of life. So my hypothesis is that novel microbiome modulating agents are as effective but safer than standard acne treatment. And if this turns out to be true, that will mean that novel microbiome modulating agents could improve the treatment of acne patients. Here you can see some of my key articles that are all assessing acne patients with different interventions. Then the comparator will be placebo and the same outcomes. About my search key, I have 2 domains, and it was approved by the SMS and the meta coordinator. At the beginning, I had almost 8,000 articles, but after the duplicate removal, it remained only 6,000. So far, we have reached the title abstract selection. We are almost done with that, and hopefully by next week, we can start the full text selection together with my co-investigator, Gabi. Let me jump to the second article that would be investigating the efficacy and safety of different doses of isotretinoin treatment in acne. As I mentioned before, acne is prevalent among approximately 80% of young adults, and oral isotretinoin monotherapy with success rates ranging from 85 to 90%. Its starting dose varies between 0.5 to 1 milligram per kilogram per day, but its side effects are mostly dose-dependent, such as dryness of the skin, increased cholesterol levels, and potential liver enzyme elevation. So far, we can differentiate two practices, the traditional one and the modern practice. In the traditional practice, we were using higher doses, shorter treatment duration, and strict monitoring. Meanwhile, in the modern practice, we were working with lower doses, longer treatment duration, and looser monitoring. So far, we don't have consensus on standard dose and treatment length. It is important because of the cumulative doses, about the checkup protocols, the reported side effects, summer usage, depression impact, and checkup frequency. So my aim is to assess global practices and outcomes of the most effective, best effective dose on isotretinoin acne treatment. As my clinical question, I would like to ask, what is the safest and most effective starting dose of isotretinoin treatment? I built a PICO framework. I'm working with acne patients and different doses of oral isotretinoin, and I will measure two outcomes. The main outcome will be the change of disease activity, and the secondary outcome will be adverse events and compliance. So my hypothesis is that lower doses of isotretinoin are as effective but safer than higher doses of isotretinoin acne treatment. And if this turns out to be true, then we might standardize oral isotretinoin practices, improving safety, effectiveness, patient compliance, and satisfaction in acne treatment. As I mentioned, I would like to collect some opinions from expert physicians about the individual patient data. I'm interested in treatment details, side effects, mental health considerations, follow-up monitoring, and treatment discontinuation. So to sum up, I'm currently having two ongoing projects. The first one I would like to end by September next year, and the second one until November 2026. I would like to conclude with the words from Thomas Edison: "I've not failed, I just found 10,000 ways that won't work." Thank you for your kind attention.
My question is, you mentioned that depression is a problem in acne, and isotretinoin has lots of side effects. Is there a link between isotretinoin usage and depression?
Yes, usually everyone wants to know this. And until now, there is no proven thing about the connection between the isotretinoin and the depression. But we can ask from ourselves whether we have bad mood because of the acne, because it's painful, it's red, maybe our makeup is not staying on our faces how we want. So maybe the depression is caused because of the acne, and the isotretinoin might be the cure for our depression caused by acne.
I'm really curious. Have you found any side effects related to probiotics?
Well, usually probiotics are really safe, but as every medication, they might have some side effects that are related to gastrointestinal problems like bloating, gases, bellyache. But usually these symptoms are present in the beginning of the treatment, and by time you will get used to it. There might be some allergic reactions if the probiotics are containing soy or lactate. And in severely immunocompromised patients, some infections might appear. So we are trying to avoid giving them this medication.
I would like to ask, I'm not so familiar with this topic, but what do you mean by bacterial regulation? So is like something edible, so the probiotic, or that it's like a cream? And is there a difference between the severity of the acne to the treatment option that you would choose?
Well, yes, probiotics can be some edible pills that you are taking next to antibiotics, for example, but you can put them in some creams also, and you can use them topically as well.
I would like to ask, what does it mean, the symbiotic? Can you explain that?
Yes, symbiotics are compound of two compounds. First of all, the probiotics, then the prebiotics. Probiotics are the live bacteria, meanwhile the prebiotics are the non-digestible compounds that are feeding the probiotics, and working together they can help to enhance the gut health, the microbiome.
I would like to know that what do you think about how known this kind of therapy, what you mentioned during your presentation, for a person who have acne?
But what is the main question?
How known this type of therapy, what you mentioned during?
So you think about microbiome modulating agents. It is a quite new field, but we are trying to implement more and more in our everyday lives. And it's not only beneficial for acne itself, but for many other things, like your gut health, your hair, your skin, and it improves a lot of parts of your body.